Physiotherapy is a hands-on job. However, the emergence of COVID-19 has changed the way that physiotherapists in Guyana bring needed rehabilitation to patients countrywide. Today, the world celebrates World Physiotherapy Day amidst the COVID-19 pandemic. The Guyana Chronicle visited the Guyana Public Hospital Corporation to get a first-hand view of how things have changed.
The department at Georgetown Hospital, we cater mainly for, we have in and out patients. Inpatients, that's the patients in all the wards we have to see. And outpatients are mainly patients that we call patients who have trauma. All right. The department of the Palms, they would see the neurological cases. So like your patients who have had a stroke, patient who had a head injury, a patient who, because of an accident, they become a paraplegic or tetraplegic. Those neurological conditions, they're seen across at the Palms. But the patients here, at the outpatients at Georgetown Hospital, they're the ones who have like the fractures, post-fracture, your arthritis cases, your low back pain, those sort of cases we would see here.
In August, the month of August, we saw over 500 and something patients from all the different wards in the hospital. And this is where therapists would have, patients would have been referred, and the therapist would have done an assessment and given physiotherapy management on the ward. In the department, of course, the load is not as before because due to the COVID-19, patients are afraid to come to the hospital, like if they're getting a little knee pain or a little back pain. So we find that we divide up these patients who are afraid to come. We do telemedicine. So we would send pictures to them, showing them exercises. And those who want to come into us, maybe their case is more complex and can't be managed through social media, telemedicine, they would come into us. In other countries, you would have like better internet, so people can actually do like video calls, right? Also, what's happening here, our patient is a little older, and they might not have the, they might not be techy. So what we do, we send pictures via WhatsApp. So, just showing them exercises, like an exercise sheet we would send, and then we use the telephone where we call and check, ensure they do the exercises, encourage them to do the exercises. So that's how we do our telemedicine here at GPHC. Since COVID-19, things have changed significantly. The patient would come to the doctor here at GPHC hospital. They would get a referral from the doctor. So when they come to us, we would give them a date. Before they come back to us on that date, we will telephone them, and we have a questionnaire, a COVID-19 questionnaire that we will ask them. So we have questions like, were you in contact with anyone with COVID-19? Did you travel to any region that would have an increase in cases?
Screening.
We would screen them before they come in. And we would ask them like certain questions. Do you have a cough? Do you have a temperature? And those kinds of things. And based on that questionnaire, we will give them a day to come in to us. And we would also screen them when they get here by testing their temperature and asking them a few more other questions. So before COVID-19, we just came to work. We just did everything that we had to do. Maybe at times we would use a glove. But now we have to be so careful that we have to use all the PPEs available. So this can be from head cover, face mask, face shield, gowns, gloves, shoe covers, right? And mainly all those would be worn in the wards. But down here we would use a face mask, a face shield, and gloves.
Right now we're working at GPHC's wards, all the open wards, helping patients that cannot move themselves, helping patients who can't breathe properly, just helping patients to feel better and to actually move. because a lot of the patients are bedridden right now. A lot of the patients are having a lot of respiratory problems, and we're just helping them ease a bit of those ailments. So I personally am seeing a lot of increase in respiratory patients. So patients with a lot of respiratory distress, they have a lot of secretion in the airways that we check for, and we help to remove those secretions, okay, by using chest physiotherapy. All right, we help those, we suction the secretions out sometimes. We help them increase the lung capacity, all of these. We treat every patient as a possible COVID-19 patient. There's a lot of patients right now with coughing, with fevers. So we have to be very careful when we're working with each patient because this is a very hands-on profession, right? A lot of patients we have to touch, we have to move the limbs. So it's very important that we're all very, very careful when we're working with each patient.
We're trying to go work almost at the side of the patient, at the back, so in case the patient have coughing, so we're trying to be at the side or the back, not in front, but we keep the distance, right? Sometimes we also take the patient to take a sunlight, which is very important for the patient with COVID, right? Well, that's it. We are here to help patients, and so we are a healthcare professional, so we trying to save, we help to save lives.
Since the 6th of May, the Physiotherapy Department was tasked of going into the COVID-19 ICU. From then, we saw over 56 new patients in that unit. The physiotherapy became part of the frontline workers, where we work with the doctors and nurses. So in the ICU, mainly are for patients who have severe signs of COVID-19, and this would be like in respiratory distress. So they would normally be on like a ventilator, or they would have on oxygen mask. So in this unit, we will do mainly respiratory physiotherapy, and we will also ensure that they will be mobile. Even though they're in bed, we do a lot of mobilization exercises.
Physiotherapy is very important in order to help that individual to get back to their previous level of functioning, all right, based on what their condition is, all right. I think we don't realize how important it is until we are one of our there is an injury to probably our shoulder or probably our knee or ankle or foot, all right, and then we realize how important each part of the body is, and so our role is to help persons to get back to their level of functioning based on their condition. There are some people who may not be able to get back to their previous level, their pre-injury level, but then we work with them to help them to be able to function within the society, be able to carry out their activities of daily living, and so forth. Okay, this is the physiotherapy department. I'm working with a patient who has some problems with his shoulder. So I am working with him. Even though we are quite aware of the current situation, the pandemic and so forth, what we have in place in order to protect ourselves and to protect our patients, patients will wear their masks during therapy, and the therapists as well will ensure that they have the necessary protective gear so that they are both protected in this situation. He had a fall, and so he injured what we would call the rotator cuff muscles of the shoulder. All right, and so he was in pain and all the like. He was seen by his doctor and so forth. And now he's referred to physiotherapy because the muscles of the shoulder, they're weak and they're painful. So, and he's unable to do normal activities with the shoulder. All right, so he's here for us to work with him to strengthen back his muscles and to get him to increase his functionality, as we would call it. So I'm working with, all right, so just make a cuff, all right, and push right up. Hold there, 1, 2, 3. Good, slowly down. We do 5. Up again, 1, 2, 3. And slowly down. Up again. 1, 2, 3, and slowly down. Good, beautiful, very good, very good. All right, so you'll take a rest now. For him at the moment, it's just movements I have him do that. Good, come back to this point. All right, drop with the wrist straight. Good, and up, drop again, and up, drop again. Okay, and relax. All right, then we get it out to this side, back to that point, over, slowly, take your time. Good, 2 more. Good, 1 more, and relax. Beautiful. Thank you very much. What it involves, it's a lot of exercise, but also patients, you have to really encourage the patient because some of them are in quite a lot of pain to do their exercises, all right? It's not a case of just telling them to do their exercise and just leave them at that. You actually have to see them go through the exercise, encourage them, motivate them, and so forth. Here, what we probably need would be the services of like a psychologist, because we do see patients who because of their condition, they're really depressed. We can only do so much. We are not trained in that area. And some of them can really do with some help. A few children do come in. Those would be children who've had like a fractured arm or a fractured leg. With children, like an adult, I could say, can you bend your arm or move your arm? You know, but a child, it's different. So you have to think about activities of play, because that's what children do a lot, play. All right, so a child has a stiff joint, a stiff elbow joint. You have to think of some activity, some fun activity, all right, that will still help you to achieve what you want to get from that.
Especially in the wards, we try to get patients up and about. And once they're up and out of bed, that means we can have more hospital beds available. So we help, to speed up discharges from the hospital. So that's key when we're in the ward. When we're down into the department where we have patients coming into us, we help them to aid in their recovery. Sometimes you might have an injury that you think you might not need physio, and that injury can last you for years. But with physiotherapy, your healing process will be speeded up. It would speed up, and it would be like within a month or a month and a half. So some injury where people are walking around with for years, if they would have had the intervention of a physiotherapist, it would be within a shorter period of time, because when we do exercises, it's to promote muscle healing or joint healing. It's to strengthen up a joint. It's to help a joint to move better. And not only better, but to help it move the right way. Because you can have movement in a joint, but it's not necessarily the right smooth movement that the joint is designed to have. So the gym is where they can do exercises, they can use a bicycle, they can use the treadmill, and there are other stuff that they can use there, the small weights and so forth. So it's an open area where they can do their exercises and move their joints freely. I think one of the things that will help us and will help the patients would be when patients are referred early to us, because the earlier the patient is referred to us, the better the outcomes would be. When patients take a very long time to be referred to us,
then you find that the joints are stiff, the muscles are weak, and it's harder work for us. So if patients are referred, if the medical facility will refer patients to us very early, all right? We know what to do. We know how much to do, you know, in those early stages after a surgery or so forth. The outcome would be much better.
We've been having more physiotherapists coming on into our service, and our area in the department is a little limited. So I think we need like a bigger area where we can have more staff so we can see more patients. So I would have started first as a work study student, and then I would have done the rehabilitation assistant training program through the Ministry of Health. And when the program was available at the University of Guyana, I was in one of the first batch that university trained.
In July of 2020, I celebrated 30 years as a physiotherapist. So I've been in the profession for a long time. But like Simone, I started out as a physiotherapy assistant. Then I later went to Jamaica and did my training there as a physiotherapist. I enjoy seeing the results of working with a patient. Somebody who probably was just comes into you and they're unable probably to comb their hair or to even brush their teeth, those little activities. And after working with them, you know, to see that they can do these activities for themselves instead of getting people to help them, that brings a joy, and that's where I get my greatest benefit. That's how I feel good about to see people improve from whatever little I would have done with them.
What made me happy for the first time when I saw the patient, he was just in the bed, he couldn't do anything for himself and so on. And then of recent, I was in another ward, and then I saw him, and he was like, you know, I'm getting discharged today and whatever not. So he's now walking and he's doing things for himself. So that brought a joy and a zest in me. We need more physiotherapists to launch out and, you know, go out into the deep. Physiotherapy is actually a nice program because you help patients to regain their independence.
So this is Ms. Trotman. She has osteoarthritis in the left knee. So we already applied ice to the area for 15 minutes. And we're just going to do some heel slides because it's very painful today, so I'm assisting her. So just push down for me. Slow, without dropping. Good. Back up. Slow, right? Down. Up. Down again. Up. So, just to increase the muscle strength to the area for the managed condition.
World Physiotherapy Day is celebrated throughout the world, wherever they have physiotherapists. It was first celebrated in 1996, even though the association, the World Confederation of Physiotherapists, that association was formed since in 1951. It was formed on the 8th of September 1951. So in 1996, they started celebrating World Physiotherapy Day. Guyana became a part of the world body, became a member of that world body in 2007. And so every year we would celebrate with our colleagues around the world, celebrating physiotherapy.